Hi, I'm Lisa Kudrow. I'm glad you're here today. Mental health care and education is important to me. That's why I chose to become involved at UCLA, joining the Resnick Neuropsychiatric Hospital Board of Advisors and emceeing the galas and #WOW, the Wonder of Women Summit. I'm so excited that WOW and UCLA's Friends of Semel Institute Open Mind have joined together to bring outstanding, free virtual programs about mental health issues. This means you will hear conversations on the intersection of culture and science between renowned authors and filmmakers who share their personal stories and world-class UCLA scientists that highlight the latest in mental health research, care, and progress. I'm thrilled to welcome you to our Open Mind WOW series and hope to see you at many more programs.
Hi, I'm Vicki Goodman, and I too would like to welcome you to our Open Mind program on mental health and the virus that has affected all of our lives, COVID-19. The Friends of the Semel Institute for Neuroscience and Human Behavior at UCLA, the Resnick Hospital Board of Advisors, and WOW, the Wonder of Women are honored to sponsor today's important program. A huge thank you to Lisa Kudrow for her warm welcome and for her dedication to mental health programs at UCLA. We are honored to have with us today what I like to refer to as the creme de la creme of preeminent UCLA faculty experts in mental health. A huge thank you to each of our participants for taking the time from their busy schedules to share their knowledge, expertise, and advice about coping with mental health issues related to the coronavirus. A very special thank you to Dr. Thomas Strouse for allowing us to twist his arm a little to say yes to moderating this program and for assembling this panel of experts. Dr. Strouse is the medical director of the Resnick Neuropsychiatric Hospital and a professor of clinical psychiatry at the David Geffen School of Medicine at UCLA. He is also the inaugural holder of the Mattie Katz Chair in Palliative Care Research and Education. He serves as the Vice Chair for Clinical Affairs at the Medical School in the Department of Psychiatry and is the Faculty Advisor to the Resnick Neuropsychiatric Hospital Board of Advisors. Welcome, Dr. Strouse. Dr. Katrina DeBonis, who many of you met when she was the faculty discussant for our recent Open Mind program on bipolar disorder with A.J. Mendez, will speak about cultivating resilience amidst COVID-19. Dr. DeBonis is an assistant clinical professor at the David Geffen School of Medicine at UCLA and the director of residency training at the Resnick Neuropsychiatric Hospital. Welcome, Dr. DeBonis. Dr. Eraka Bath is associate professor, Department of Psychiatry, and Vice Chair for Equity, Diversity, and Inclusion at the Semel Institute. She is also Director of Child Forensic Services. Dr. Bath will speak about racism and public health. Welcome, Dr. Bath. Dr. Patricia Lester will address the impact of COVID-19 in Los Angeles County through the Department of Mental Health and UCLA Public Partnership for Wellbeing. Dr. Lester is the Nathanson Family Professor of Psychiatry, the Director, Division of Population Behavioral Health, the Director of the UCLA Nathanson Family Resilience Center, and the Vice Chair for Community Engagement. And lastly, Dr. John Piacentini will speak about COVID-19, anxiety, and effects on children and families. Dr. Piacentini is a professor of psychiatry and biobehavioral sciences, the director of the Center for UCLA Child Anxiety and Resilience Education and Support, known as CARES, and the director of Child OCD, Anxiety, and Tic Disorders programs at the Semel Institute. Welcome, Dr. Piacentini. Just a few housekeeping notes. Today's program is being taped, so if any of your friends, colleagues, or family were not able to join us today, they will have the opportunity to watch the program on the Friends of the Semel Institute's website, which will take you to our YouTube channel. While you are there, you may want to check out some of the videos from our past Open Mind programs. And please, why not take a moment to subscribe to our YouTube channel? It's free, and we would really like to continue to build up our audience. Our program will run for approximately 1 hour, with the last 15 to 20 minutes reserved for question and answers. Everyone's Zoom has been placed in mute, and we ask that you please allow it to remain in that position. You may ask questions of any of our speakers by typing them into the Q&A, which is at the bottom of the Zoom. We will do our very best to get to as many questions as possible. Now, please join me in giving a warm virtual welcome to Dr. Tom Strouse. Thank you so much.
Thanks very much, Vicki. And let me welcome our entire audience to this important Open Mind event. Tonight, as you heard, we're going to talk about a daunting topic, the psychological consequences of the COVID pandemic. Of course, we've all been touched by it. Each one of us has worried about contracting the virus. Some of us actually had it. Some of us have lost loved ones to it. Our jobs, our workplaces, our communities, and our homes have all been transformed, and we don't know when or to what we will be returning. We'll be talking some tonight about coping, how all of us trying to make it through our days can better manage our distress. We'll also be hearing about how communities of color have been disproportionately and tragically affected. We'll be hearing about some of the data that describes pandemic-associated increases in the frequency of mood and anxiety and substance use disorders in Southern California and beyond. And we'll be hearing about how children deal with the stresses of the pandemic, how families are affected, and how parents can optimally support their kids and themselves. So it's a packed hour. Each speaker is going to talk for 8 to 10 minutes with Q&A at the end, and our talented panel is ready to go. So without any further intro, I'm going to ask Dr. DeBonis to begin.
Okay, hi everyone. So talking about resilience right now feels both necessary, but also challenging. Usually when I talk about stress and coping, I use the images of red, yellow, and green to describe where you might find yourself at any given time. Green is thriving, doing great overall. Yellow is struggling to cope, feeling affected by stress, but still engaged and functioning. And red is really overwhelmed, disengaged, demoralized, not functioning very well. Of course, we would all love to live in the green zone, and maybe some of us do a good part of the time. But right now, I don't really know many people, if any, who are in the green zone. Most of us are in the yellow zone. We find ourselves struggling during this time, and more people are finding themselves in the red zone. And so I think it's important to set realistic expectations for ourselves and those around us during this time. During a uniquely difficult time, such as this one, we're unlikely to find ourselves thriving. But I think we can hopefully stay in that yellow zone, maybe hit green every so often, and really try to minimize our time in the red zone. It's also important to recognize that this time is unique and that there isn't just one stressor, and none of the stressors we are facing right now have a clear start and end time. Our resiliency challenge these days, and it really is a huge one, is to allow ourselves to recharge and recover enough each day so that we can continue to withstand the multiple chronic stressors we are facing. So I'd just like to say what we're doing right now, all of us, really isn't easy. It's really quite hard. And I think we can recognize and give ourselves credit for all that we're doing to get through this. And so when I talk about psychological resiliency, what I'm referring to is a person's ability to recover from adversity. And in studying how people respond to trauma, we have found that there are certain traits that seem to help people in this recovery process. And so we know that our resiliency is shaped by the genes that we're born with and the things that happen to us in childhood. And we also know that we can actively strengthen some of the neurobiological and psychological elements and thereby build our resiliency, make ourselves a little stronger. So over these next few minutes, I hope to share some of what those aspects are and how we might use them to get through this time as best as we can. So I'm going to start with the neurobiological aspects of resilience. And so some of you may know, but our brains and our bodies are hardwired to respond to stress. Our brains perceive a danger and signals are sent so that we can protect ourselves. This is also sometimes known as our fight or flight response. And then when the danger or the threat resolves, our body has a built-in system for recovery. And this can look very different for people. So it's important to take a moment to ask yourself, what does it feel like when I'm stressed? And do I have an effective and ideally healthy way for dialing it down? Sometimes the things we turn to for an off switch aren't the healthiest. And this is where activities such as meditation, exercise, yoga can come in. So all of these things, and I'm sure you've heard of them as being helpful for wellness. And what they do is they have the effect of promoting the recovery of your stress response. And so you might benefit particularly from focusing on one of these areas if you're experiencing a lot of physical symptoms with your stress, muscle tension, headaches, nausea. And just a quick story, but even with my background as a psychiatrist, I've been at times slow to realize my own stress response. I developed really bad jaw pain to the point where I couldn't even chew. And I went and saw an excellent maxillofacial surgeon who told me that it was stress and reminded me that the treatment was in my area of expertise, not his. And so this was, of course, very humbling, but also very helpful. And although I recommend relaxation exercises to my patients all the time, I had never really practiced them regularly, and this motivated me to start. And so fortunately, it was really effective and my symptoms resolved within a couple of weeks. And so I would like to encourage that if you're not regularly doing some type of activity that helps with relaxation, that you should focus on one, practicing it consistently, a little bit at a time. And then there are the psychological features of resilience. And so there's a lot, and I can't cover all of them right now, but a few that I think are really applicable to the moment that we're living in right now are finding meaning, aligning with our moral compass, positive emotions and enhancing them, and acceptance. So I'm just going to speak a little bit about a couple of those. This is a really good time to be asking yourself, what do I stand for? And what do I do about it? Putting our moral compass into action is a powerful contributor to overcoming adversity. And this does not have to be big action. And we really should avoid getting into those mental traps that if we can't do something big, then we shouldn't do anything at all. This can be small acts of kindness towards someone else or finding a way to stand up for what we believe in. And it might seem obvious, but people who have more positive thoughts in general tend to demonstrate more resiliency when hit with hard times. And you may have heard of things like gratitude journals, and this comes from studies that have shown that taking the time to intentionally think about and write down a few things each day that you are grateful for can lower stress and improve your sense of well-being. And if you've never tried it, it's certainly a free, relatively quick, and likely to help thing to do. And I should say sometimes these things can feel a little forced or superficial. And the idea is not to just list the things that you know you should be grateful for, but to find a way to feel the gratitude for those things. And so maybe for you, it's not writing down the words, but bringing up an image and holding on to it for a minute. I do think that the percentage of negative thoughts that we're all carrying around right now has increased by a pretty sizable amount. And unfortunately, there isn't really a lot on the other side balancing it out of good stuff. So I think we really need to make a bigger deal than usual of the good stuff and really celebrate and relish it when it comes along. These good moments can easily get swept up with the stress and otherwise kind of difficult or crummy days. And so I think we have to make sure that we're not only paying attention to the bad stuff and the hard stuff, that the good stuff is getting its fair share of your mental energy. Another feature of resilience that can feel somewhat tricky right now is the idea of acceptance. So acceptance is not resignation. It's recognizing the things that are outside of our control and focusing on the aspects that we can control. And right now there is so much that is outside of our control, and that can really and I know for me, can contribute to a sense of helplessness. But even taking the smallest step of action can move us away from that feeling of helplessness. And so we can ask ourselves, what can we control? And there's a lot of things. We can control how we treat one another. We can control where we spend our money and what businesses and causes we support. And sometimes we can find overlap, and that's a wonderful thing when we can find ways to connect what is within our control with our moral compass or sense of meaning and purpose. Sometimes what is within our control is more directed at preserving our energy or giving ourselves what we need, putting our phones away or limiting news consumption when we're too close to that red zone or going for a walk. Those are all things that we might be able to do. So now, if we are to put energy into cultivating these aspects of resilience for ourselves, I believe that it's most effective when it occurs in the context of individualized awareness. It's hard to give ourselves what we need if we don't know what that might be. So I recommend trying to check in with yourself more frequently, particularly during this time. Ask, how am I doing? What might help me? What do I need? I used to do this on my car rides back and forth from work, and sometimes it was a song, sometimes it was calling a friend or listening to NPR. And that choice depended on how stretched I was feeling or what my day had looked like. And so now I don't have those transition points as much when I'm working from home. So I've had to adjust. I try to do it in the morning a little bit when I'm drinking my coffee, and in the few minutes I get at the end of the day when I'm winding down. And I also importantly try to ask myself this when I pick up my phone. What am I looking for? Will this help me? Is it likely to make me feel worse? And over time, this process of checking in and trying to respond to what comes up when you ask yourself this can help us care for ourselves better, particularly when our reserves are running low. And so in closing, I would like to acknowledge that simply getting through the day right now is evidence of our resilience. And we could definitely benefit from giving ourselves and those around us more compassion for what we are going through right now. And so with a virtual extension of compassion to all of you, I'll hand it back over to Dr. Strouse.
Thanks so much, Dr. DeBonis. That was terrific. I think the answer to the question, what am I looking for when I pick up the phone, is almost always nothing of use. So I hope that our audience can take that away. So we'll come back to you with some questions at the end. I'm now going to pass it on to Dr. Eraka Bath, who's going to talk some about the topic of disproportionate effects of the pandemic on communities of color. Dr. Bath?
Thank you. I'm here today to talk about COVID-19 and race. The color of COVID is black and brown. We cannot separate race from COVID-19 or COVID-19 from race, and we are dealing with dueling pandemics. The president of the American Psychological Association, Dr. Chandra Shulman, stated it well. We are living in a racism pandemic, and it's taking a heavy psychological toll on our African American citizens. The health consequences are dire, and racism is associated with a host of psychological consequences, including depression, anxiety, PTSD, and substance use disorders. The stress caused by racism is toxic and contributes to the development of chronic disease and premature aging. The statement, "I can't breathe," is as relevant for COVID-19 as it is for police violence against Black people that has aggravated our year of 2020. The color of COVID should not be a surprise, therefore, if we begin to unpack and understand systemic racism, which is a public health issue. To illustrate this, let's consider 4 cases that were highlighted in a recent LA Times article. Gary Fowler, a 56-year-old Black man, was denied COVID-19 testing and hospital admission by 3 Detroit emergency rooms where he complained of difficulty breathing. Deshaun Taylor, a 23-year-old Black man, was sent home twice from a Chicago hospital, even after testing positive. Reginald Ralph, a 50-year-old Black man, was turned away from an urgent care clinic in suburban Chicago without being tested in spite of his labored breathing, fever, and cough. And then let's not forget Kimora Lynham, a 9-year-old Black girl with a fever of 103 degrees. She was sent home from a Florida academic medical center without being tested. All 4 of these individuals died soon after their contacts with these health systems. Black people are at the mercy of the American healthcare system, a system that is supposed to help them breathe, but instead is keeping them in a chokehold with a knee on their necks by sending them home to die when they say, "I can't breathe." Why does this matter? Black and Indigenous Americans experience the highest death tolls from COVID-19. Black Americans continue to experience the highest actual COVID-19 mortality rates, with death rates more than 3 times the rate of whites and Asians. As of September 15th, 2020, according to the APM Research Lab, 1 in 1,000 Black Americans have died from COVID-19, 1 in 1,200 Indigenous Americans, 1 in 1,400 Pacific Islanders Americans, and 1 in 1,500 Latinos. If these people of color died of COVID-19 at the same actual rates of white Americans, there'd be a total of 32,480 people still alive. Why? These disparities are the result of the overarching, all-consuming, omnipresent pandemic of racism, which is at the root of negative outcomes for COVID-19 across communities of color. Racism causes structural inequities and results in negative public health effects. Racism creates limited access to testing, causing delayed or worse medical care due to lack of insurance and provider bias. What is systemic or structural racism? Structural racism refers to differential access to goods, services, and opportunities by race. The physical and structural environment in which people grow, learn, work, and play shapes intergenerational population health. Poverty is therefore structured, but so is privilege and economic advantage. Health inequities arise when certain populations are made vulnerable to illness or disease through inequitable distributions of protections and supports. Pre-existing conditions like diabetes, hypertension, obesity, and asthma, conditions that make people more vulnerable to COVID-19, are exacerbated by structural racism and have roots in structural racism. Let me give you some examples. Hand washing and water access is not an equal opportunity. We say hand washing is the cheapest and one of the most reliable ways to mitigate illness from COVID-19. Yet it is race that is the strongest predictor of water and sanitation access. African American and Latino populations are 2 times as likely to lack access to clean water in their homes, and Native Americans are 19 times more likely to lack access to clean water. It's time to recognize that social distancing is a luxury item. It's a privilege and easier to do when you have resources, stable housing, and housing that is spacious. We know that Black and brown people are more likely to live in denser housing, crowded and multi-generational households, and therefore more vulnerable to falling ill than those who live alone or in smaller families. Furthermore, residential segregation drives Black and brown families' disproportionate exposure to areas where there are higher pollutants and environmental toxicities. It's no surprise that these same zip codes are also food deserts, suffer from underperforming schools, neighborhood blight, and chronic disinvestment. There are no Trader Joe's and Whole Foods in these neighborhoods. The digital divide. The digital divide is not only about kids not having access to appropriate technology like iPads and laptops. It's also about not having enough broadband connectivity to adequately log on and learn, or the quiet and private space to Zoom and learn. This is not just about youth, though. Adults' digital divide realities converge in a strikingly similar pattern along class lines. There are stark differences in being able to get a paycheck and benefits while working from the comfort of your home and tweaking your Zoom background versus those jobs that are dependent on being in person and thus at higher risk for exposure. So we have a situation where Black and brown people are considered essential but expendable due to disproportionately being overrepresented on the front lines of low-wage, in-person jobs and experiencing greater workplace exposures, including inability to work from home, lack of access to sick days, all of which place them at higher risk for getting sick. So I ask you to think about who has to take public transportation to work, who's working in public transportation, who's working in post office, grocery stores, meatpacking factories, and assembly lines, who is cleaning houses. These inequitable economic realities have been historically structured for 400 years. The economic fallout for COVID-19 is real, and Black and Latino households with children bear the brunt of the hardships. One recent survey showed that 60% of households with children in the United States reported serious financial problems. Of these, 86% of Latino families and 66% of Black families reported struggles to afford medical care and are experiencing depletion of household savings and difficulty paying credit card and other debts without the ability to do so due to the Black and white wealth gap. What is this gap? The Black and white wealth gap makes this fallout even harder. It means that for every dollar of wealth that a white family has, a Black family has a penny and a Latino family has 3 pennies. Put another way, white family wealth was 7 times greater than Black family wealth and 5 times greater than Hispanic family wealth in 2016. Despite some fluctuations over the past 5 decades, this disparity is as high or higher than it was in 1963. The economics of racism cut multiple ways and is hurting our nation's economic vitality. One study done by the Citigroup found that there is $16 trillion lost in gross domestic product due to racism, noting 4 key racial gaps between African Americans and whites. $13 trillion lost due to lending, discriminatory lending to African American entrepreneurs, with a lack of 6.1 million jobs not generated as a result, $2.7 trillion in income loss because of disparities in wages suffered by African Americans, $218 billion lost over the past 2 decades because of discrimination providing housing credit, and $90 billion to $113 billion in lifetime income loss from discrimination in accessing higher education. Lastly, if we want to talk about racism and mental health, we need to talk about police violence. Roughly 1 in 1,000 Black men can expect to be killed by the police in their lifetime. This is close to the same rate that Black Americans are dying of COVID, which is also 1 in 1,000. Police violence and state-sponsored terror represents the forceful muscle and weaponization of racism that has been part of our nation's legacy and blueprint since its founding. Studies show that when unarmed Black people are shot by the police, Black people in the same state have more negative mental health days. Studies show that when unarmed Black and brown people are shot by police, absenteeism and school problems increase for Black and brown children. The punishing reach of racism is operative from womb to tomb, and we see that there is no sanctuary from racism for Black and brown bodies, whether bird watching, Christian Cooper, sleeping in one's bed, Breonna Taylor, or jogging while Black, Ahmaud Arbery, or in hospitals. What can we do? In this time, we need to self-reflect. We are losing time, money, lives, and life years. Are we going to stand back and stand by? Or are we going to get in the good and necessary trouble to marshal the resources needed to course correct racism and its related health inequities? What zone are you in and where do you want to be? Thank you.
Thanks, Dr. Bath. Deeply troubling content, but a really terrific talk, and I'm sure we will return to it in our Q&A. We're now going to move to Dr. Patricia Lester, who, as you heard, is among her many jobs, the director of our Division of Population Behavioral Health, which is kind of like psychiatric epidemiology, and she's going to be talking about psychological impacts of the pandemic in Los Angeles County and beyond.
Thank you, Tom, and thank you to Vicki for including me today, and to the Friends of Semel for elevating mental health awareness and education, both at UCLA and across our community. First, I want to start by acknowledging that we are truly living through a once-in-a-lifetime situation. The pandemic, one that is compounded by the cumulative adversity of ongoing systemic racism, economic instability, political turmoil, and climate change, and now fires. This is really, truly a difficult time. And if you are feeling the stress of this time, as Dr. DeBonis said, you are certainly not alone. The impact of COVID-19 on health really appears to be only the first wave of its impact. And we are seeing the second and third waves already unfolding on behavioral health across our population. So what does the data show? A CDC survey in late June with 5,400 US adults found anxiety, depression, and suicidal ideation were significantly up this year when compared with previous years. Anxiety was reported at levels 3 times higher than the same period last year, and depression 4 times higher. And twice as many respondents in June said they had considered suicide in the prior 30 days when compared with the number of adults who in 2018 said they had considered suicide in the full preceding 12 months. Researchers found that over 13% of all respondents said they had begun or increased substance use to cope with stress related to the epidemic. And this is consistent with what we're seeing around opioid relapse. The Household Pulse Survey conducted by the CDC's National Center for Health Statistics surveyed about 900,000 US adults in multiple waves and have seen that both anxiety and depression have been rising since America's coronavirus epidemic reached its first peak in April. And it's really striking the levels of at-risk anxiety and depressive symptoms reported. 41% of adults across the US reported either anxiety and depression or both at these risk levels, and 44% of Californians did so as well. I think put in perspective, during January and June of 2019, only 11% reported this same level of symptoms of anxiety disorder or depressive disorder. As Dr. Bath has highlighted regarding COVID's uneven and disproportionate impact on people of color, this survey reflected disproportionate toll on Hispanic and Black Americans' mental health outcomes. The survey also shows something that I think we should all be thinking about, that young adults, those ages 18 to 24, appear to be at particular risk right now, with more than half of adults in that age group reporting symptoms of at-risk depression, and more than a quarter reporting that they had considered suicide in the preceding 30 days. If we think about this developmentally, the pandemic has posed unique challenges to the tasks of emerging adulthood. Graduating from high school maybe didn't occur, finding employment, going to college, isolation from peer relationships, all threatened by our unstable economy and our current civil unrest. Additional risk groups have been identified: unpaid caregivers and essential workers, and parents with young children. And we've all thought quite a lot about the impact on our healthcare workers from both a stress and exposure perspective, but there's also a range of other frontline workers in our communities: disaster service workers, child welfare workers, who all are at increase for mental health problems related to secondary traumatic stress, burnout, and moral distress. Mental health professionals report an overwhelming influx of calls from people of all ages experiencing grief, isolation, substance use, intimate partner violence, and homelessness. And to give a sense of the volume, the SAMHSA Disaster Distress Helpline reported an 890% increase in calls in March 2020 compared to March of 2019. I think all of these data just begin to scratch the surface of what we're going to learn, but they also point out that we need a population-level public health response to COVID, not only to COVID-19 as a health threat, but to the behavioral health burden, the complex one that Dr. Bath has so well outlined that we are facing right now. What is a public mental health response? Well, a public mental health approach focuses on promoting mental health as well as preventing and treating mental illness. The entire population benefits from a tiered approach to the promotion of well-being, to prevention strategies to mitigate risk and enhance protective factors, like some of the resilience factors that Dr. DeBonis spoke of, and to identify mental health problems early and provide early treatment interventions and support in sustaining recovery. A population mental health approach necessarily requires addressing structural and social determinants of health, such as systemic racism, if we are to be successful. We have to address the conditions in which people are born, grow, work, live, age, and the wider set of systems that shape our daily lives. So I wanted to share a little bit with you about what's happening in LA County, particularly through a partnership that LA County Department of Mental Health, through the leadership of Dr. Jonathan Sharon, has built with, prior to COVID, it's known as the DMH UCLA Public Partnership for Wellbeing. And the vision of this partnership was really to leverage the strengths of our two world-class public institutions, LA County's largest mental health system in the country, and UCLA as a large and leading public university, and coming together on behalf of elevating well-being and mental health, not only in our health service systems, but in our many ecosystems across the county, schools, communities, employment settings, as well as engaging and assisting our underserved residents by improving broken and inequitable systems and working to build equity into societal structures through policy changes. This interdisciplinary investment in well-being led by LA County Department of Mental Health is really mirrored in the structure of our larger public partnership, one that draws broadly across UCLA, not only from the Semel Institute and the David Geffen School of Medicine, but also from the Graduate School of Education and Information Science, the Luskin School of Public Affairs, the Interdisciplinary Depression Grand Challenge, and the College of Economics. This is a partnership that is both robust and unique and has really supported a rapid response to COVID by supporting the Department of Mental Health as well as its partner county agencies. And I just wanted to highlight 3 areas where we're working together in an ecosystem to really attempt to mitigate some of the mental health burden of COVID. The first ecosystem is the workplace. We focused on providers on the front lines. And almost immediately, as the stay-at-home orders were issued, we were able to leverage this already established partnership through 2 large training centers, the Prevention Center of Excellence led by Dr. Catherine Mogul and Dr. Norwita Milburn, and the Public Mental Health Partnership led by Dr. Beth Bromley. These teams immediately worked with the Department of Mental Health to launch a range of virtual trainings, online courses, reflective consultation and leadership support, and resources, really addressing the unique challenges to professional well-being facing our county's workforce during COVID, as well as delivering trainings on the delivery of psychological first aid for numerous groups within the workforce. Second, we developed and implemented training for community first responders, faith-based organizations, and health promoters in the unique mental health needs of Latino, Black, and other marginalized populations through Dr. Cynthia Tejas' Hispanic Neuropsychiatric Center of Excellence. And third, the Los Angeles County Employee Wellbeing Line was launched through the Luskin School of Public Affairs. This was led by Dr. Todd Franke at the Luskin School. And this support line really helps frontline workers and healthcare providers within the county navigate the unique well-being challenges of being on the front lines during the pandemic, with special attention to addressing moral distress. The next ecosystem that the partnership has been supporting as a COVID response is educational systems and schools. The UCLA Pritzker Center for Strengthening Children and Families, led by Dr. Tyrone Howard, has joined together with the LA County Office of Education, as well as DMH, to assess and address the challenges of reopening schools, particularly on the well-being of students, families, and teachers and administrators, and with a focus on those facing racial injustice and inequity. And the UCLA Depression Grand Challenges, a STAND program led by Dr. Michelle Krask, will be utilizing technology-based platforms to have a broader reach and access for college students at East Los Angeles College, and to address mental health conditions early and address suicide risk. And in our community, LA County has launched a community ambassador network, which is really designed to both support community outreach, engagement, reduce stigma around mental health care, but also to empower and create a career path for community members who have lived experience of mental illness or caring for someone with a mental illness. And we believe that this community ambassador network can really start to help those communities most disproportionately impacted by the pandemic, by systemic racism and the resulting civil unrest, as well as ongoing hardship. So the Public Partnership for Wellbeing, the UCLA teams I mentioned before, will be working together to support the training of these community ambassadors. And I don't have time to talk about all of the efforts that we're doing, but if you want to know more, you could look on the wellbeingforla.org website. And I just wanted to end by, I think like Dr. DeBonis, thinking about at this time when we all are either often in the yellow or red, what each of us can do to navigate this time. And remember that simple acts can make a big difference. Simple acts of self-care in terms of getting enough sleep, taking care of ourselves, getting exercise, practicing mindfulness, but also supporting others, remembering that social connection and relationship is really a core aspect of the process of resilience and supporting resilience. So, you know, people did this a lot early on. They were reaching out broadly. I think I did that too. But no matter how tired or burnt out we are, it's important to reach out and check in with each other and let people know that we care.
Thanks so much, Dr. Lester. Wonderful summary of really wide-reaching work throughout LA County. We're grateful. Our last speaker is Dr. John Piacentini. Dr. Piacentini has dedicated his career to caring for children with various forms of anxiety and, by extension, helping their families. And he's going to talk about those topics as they pertain to the pandemic. Dr. Piacentini.
Thank you, Dr. Strouse. It's a real pleasure to be here, and I want to thank the Friends of Semel for this amazing series. So I'm going to talk about kids. A lot of what you have heard is certainly pertinent to kids, because I'm going to talk about parents and families as well. And the first thing I want to do is start with kids and their experience going through COVID, and just some of the findings that we have from here. But let's take a step back, because some surveys have been coming out over the past couple of years looking at stress in children and adolescents of different ages. And this has been a really stressful time for a lot of kids. For the first time in the history of this one very large survey put out by the American Psychological Association, Gen Z kids, so kids aged 10 to 25, describe their mental health as much lower than that of older groups. Only 45% of Gen Z kids in this one survey described their mental health as very good to excellent. This compared to 70% of baby boomers, 56% of millennials, and much higher rates among other age groups as well. So our Gen Z kids are really dealing with a lot of stress, and they are expressing concerns about their mental health and their ability to function even before COVID. And some of the things that these kids worry about more than other groups, more than any of the other age groups, the Gen Z kids are reporting concerns about mass shootings, climate, racism, racial unrest, suicide, and the like. And we've heard a lot about some of these things from the other speakers. And the reason that the Gen Z kids are worrying about this stuff is because it really is going to affect them. I talk to my own kids, and they're saying, yeah, you guys don't need to worry so much about global warming because you're not going to be around. But it's the next generation that is going to have to clean up the mess. And we're seeing that play out. Now, as you heard from the other speakers, we overlay COVID. We overlay the racial unrest, climate change, and the fires. And it is a really, really difficult time for families, for children, for adults as well. A lot of studies have come out, you've heard about these, showing that COVID-related stress is leading to increased depression, psychological difficulties, loneliness. Some of the studies related to parenting show that the more stressed parents are, the more difficult it is for their kids. So there's an interaction here. If the parents are overly stressed and unable to provide care and comfort to the kids in ways that they typically do, the kids are going to have more difficulties. The more difficulties the kids have, the more stressed the parents are going to be. And this is even worse for kids and adults with pre-existing psychiatric or other types of problems. So we know that everybody is demonstrating or expressing this stress related to COVID through changes in sleep, diet, mood, anxiety, irritability. But we do see some age-specific trends as well. Younger kids miss their friends. They miss the routine of school. They may not be able to understand where these changes are coming from. It can be very confusing. They may not understand why parents are so upset. Older kids, it's the same. Friends, school, boredom, lack of physical activity. And these kids are worrying about family finances, worrying about the health, worrying about future. And then we see our older adolescents and our college students are worrying about these milestone events that they're missing. They're missing graduations, they're missing proms. Looking at the jobs are all drying up. The future is really frightening. I had 3 kids graduate between May and June of this year. We had great plans for travel and graduation parties, and all 3 of these graduations were canceled. Very devastating for all sorts of reasons, and we're all going through these similar things. So these are the typical reactions. These are the reactions that most kids and most parents are facing. Let's talk about some ways that you can keep your kids physically and mentally healthy during these times. And then I do want to talk about kids that, very briefly, kids that are having more difficult problems. So we need to balance physical health by protecting our kids from COVID, and we need to balance their mental health. What can we do? It's important to engage our kids, keep them updated about the situation. But as Dr. Lester said, this is a once-in-a-lifetime event, so we need to provide perspective and context. We need to use our judgment when talking to kids. We can certainly be honest to some degree, but we don't want to come unraveled in front of our kids, because that's going to be really terrifying as well. Limiting excessive media contact and content relying on reputable sources is going to be very important. And we need to, as I said, engaging our kids, listen and validate their concerns, provide corrective information as needed if they have some things wrong, but really we want to validate it and understand them. We also want to avoid excessive reassurance. We want to try to work with our kids to be brave, to face these concerns with the appropriate supports from us. Structure is really kind of gone to pot. We need to really try to maintain structure in the daily routine. Kids need to be active, engaged, but we need to be flexible. We need to provide kids choices. We need to give breaks for physical activity or other fun activities. I spend 5 hours a week, Monday afternoons, on our clinic. Our clinic is remote, and that's really hard to do without any kinds of breaks. Kids are spending 5 hours a day in school, and then they go online to do other things. It's really important that we set some limits. We provide different kinds of activities for them to do. And it's important for kids and for parents to stay in touch with others. Social events are really important, whether they're remote or distanced. We want to watch for signs of avoidance, stress, isolation. We want to be there for our kids. And in most cases, this will be sufficient. The problem is for kids that are already at risk for developing greater degrees of psychological problems, or at risk for other reasons, or already have anxiety, depression, other kinds of issues, this can really exacerbate. And when we're trying to help our children engage, help them problem solve, provide soothing to them, if they don't respond appropriately, if they become overly avoidant, overly distressed, the frequency or intensity of their episodes of crying or anxiety or anger or rage increases, or if their upset or anger is triggered by very small things or even unseen things, then it may be time to start thinking about help for kids. We are extremely busy in our clinic. Every colleague I talk to is taking on new therapists, is expanding practice to try to meet the needs of the kids and the families. critically important for parents to also self-care. And you've heard a lot about adult self-care. I'm not going to go into too much detail here, but there are a lot of really great information on our site, the carecenter.ucla.edu site, other mental health organizations. UCLAhealth.org has really great stuff, as does the CDC. It's important for parents to stay connected, stay informed, increase activities that they like to do, try to find things, exercise or cooking or gardening. I think I've done 5,000 jigsaw puzzles. Our dining room table was about 3 feet deep in jigsaw puzzles. I'm over that now, but you know, while I was doing it, it worked. It really helped. Maintaining routine for you and your kids, having a check-in buddy, somebody that you can talk to on a daily basis that can help you maintain perspective. And people are different in terms of the types of activities or strategies that they can use to help manage their anxiety or stress. For some calming activities, you've heard of mindfulness or yoga, deep breathing can be helpful. Others like more activating activities like walking, movement, exercise, dance can be quite helpful. And I want to reiterate, focusing on meaning and thinking about gratitude, giving gratitude, experiencing gratitude, trying to help others is really important. I want to focus now on school because that's the big issue. Just for my last couple of minutes here, many kids have adapted or doing well remotely. Others, including those with even low levels of behavioral or emotional issues, are having a hard time. Some of the schools are doing a better job engaging kids. Other schools are doing less well. So this can be really difficult. One thing that the experts agree on, and I'm a firm believer in this as well, is that social skills matter more than social studies. This is a quote from a Wired article I really liked. These social aspects of school are really important for kids. Most kids, a significant proportion of kids, are going to do okay with the limited academics they have. The one group that isn't, unfortunately, is our kids that are coming from under-resourced communities or from underrepresented minorities. As you heard from Dr. Bath, we really need to put more attention into that because these kids are seriously disadvantaged. But the social aspects of school that kids are missing are really critical, and we need to focus on those in addition to the educational pieces. And that's going to be really important in terms of providing flexibility for kids and trying to keep them engaged. Kids with learning difficulties or other special needs are going to having a particularly difficult time. They're having a harder time keeping safe because many of these kids have hypersensitivity. They can't wear masks. Some kids don't have a good understanding of social distancing or paying attention to social cues because of anxiety or ADHD or spectrum disorders, which can really interfere with learning. So it's important for parents and teachers to anticipate and avoid potentially difficult situations, to provide patience, acceptability, and flexibility. And in some cases, it may be more important to focus on non-academic goals, behavioral or emotional goals, to try to keep kids in a positive frame and moving forward. So I think that's really important. The most important thing about taking care of kids is you need to take care of yourself. Parents and caretakers really need to take care of themselves first. Like they say when you're flying, if the oxygen mask falls, you put it on first and then attend to your child. So true in this time as well. And I'll stop there. Thank you.
John, thank you. That was terrific. I want to thank all the speakers. Would you all turn your cameras back on if you haven't? Thanks so much for fitting really complex topics into very brief talks with great skill. We're now going to do lightning round because we're committed to finishing at 6 on the nose. That was my pledge to the organizers and to the audience. So we're going to go in the order we went. And Dr. DeBonis, you're first up. An audience member has asked for your 2 favorite or 2 preferred relaxation techniques that you might like to recommend. 30 seconds or less.
All right, I would either recommend doing something more physical if you think that that might be what you might need, or something more mental. So mindfulness, and the UCLA Mindful app has amazing resources there. I love the body scan for sleep, or something physical like exercising, yoga, Tai Chi, or even things like coloring. So those are my 2 recommendations. And try things and then try them for a little while. And if it stops working, try something else.
Thank you very much. Dr. Bath, I recognize that this question couldn't possibly be answered in 30 seconds to a minute, but I wonder if you might say a few words about how, as a group, a number of audience members wondered what they could do. How can we challenge ourselves to promote race equity in healthcare and elsewhere in our society?
I think be able to be uncomfortable, be information seeking, diversify your friend group. If, people in your photo albums and on your phone all look like you, then you have a diversity problem. It starts by really having it in your heart, and that means really having a diverse sort of stratosphere around you.
That was amazing. You did it in a brief time. Wow.
No.
Thank you.
Reading.
Dr. Lester, a number of audience members actually have expressed thoughtful concerns about equity and access. And you and I have talked some about this. I wonder if there are any elements of the pandemic that actually have had a positive impact on how behavioral health care is delivered, either at UCLA or elsewhere.
Yes, I think that the proof that we were able to deliver behavioral health care effectively through teleplatforms has really been a major step forward in improving the opportunity for access. It doesn't necessarily affect the disparities issues, but I think it holds promise for reaching children, families, students, supporting teachers. Many of the financial and physical barriers to getting care are removed, and we're seeing that it really does work and is super meaningful. And we're seeing it at UCLA, but also across the county.
Dr. Lester is describing in part that UCLA Psychiatry went from providing about 5 or 10% of our outpatient services via tele to about 95% via tele in about 3 days at the beginning of the pandemic. It was a transformation that was many years coming and that many people were in some ways resisting, and then it happened and it's gone extremely well. So
with basically no drop in delivery. I mean, there's same volume of care. I'm sorry. Yeah.
No, thank you for the clarification. So it's 5:59, which means Dr. Piacentini gets to bring it home. The question for you is, my child has become very anxious about my getting sick. What can I tell him or her?
That's a great question. And I just used 10 seconds of my seconds. It's important to be honest, to talk about the risk factors, to demonstrate that you are being safe and following all of the guidelines for social distancing, when masking and all of that. But we don't want to tell our kids that it's impossible, because we know that it's not impossible. And also that there's really great care around out there, that if we do get sick. But I think it's important to say that the likelihood of getting sick is quite small, and we can be careful together, and we can do things together, and we can support each other in trying to do the right thing and staying safe.
Thank you so much. So it's 6 precisely, and I think we have pulled it off. I'm sorry that we didn't get to every question that came in on the chat, but I want to thank the friends and the Resnick Wow and Vicki and our audience and our panelists for really a wonderful time.
And I would like to thank all of you, all of our panelists. You did a remarkable job. You brought it home at 6 o'clock, and I'm going to bring it to 6:01 just to thank you and thank all of our audience for tuning in today. This was really a very informative talk with a lot that we can unpack and take away. So very, very appreciative to all of you. To our open mind audience, we hope to see you back again. Our next program is on October 6th, next Tuesday, with David Kessler, the author of Finding Meaning, and he will be in conversation with Rabbi Steve Leder, the senior rabbi from Wilshire Boulevard Temple. So everybody stay well, stay safe, take care of your physical and mental health, and we look forward to seeing you again soon. Thank you very much.
Good night. Thank you.
Bye.
Bye.